Hi, I am Alina Tierney, and I am a practitioner at London Clinic of Nutrition. This is a brief video to pass on a little information about this current pandemic from a Lyme disease perspective. Before I start, it's important for me to point out that at the time of recording this video, there are no proven treatments for COVID-19 yet, and there is a huge amount of research to be done and knowledge to be gained. However, we know that China has a long tradition of using herbal medicine, and this has been actually employed during this current outbreak and during previous coronavirus outbreaks, such as the SARS in 2003. It has actually been reported that more than 85% of the people infected with COVID-19 in China received traditional Chinese medicine treatment. Although overall the data on this topic may not be robust enough to draw firm conclusions, when this Cochrane review published in 2012 looked systematically at randomized controlled trials that used Chinese herbs alongside Western medicines for SARS, they draw some interesting conclusions. They observed that when Chinese herbs were used, there was evidence of significant benefits in terms of the improvement of symptoms, including decreasing body temperature, cough and breathing difficulties, decreasing dosages of corticosteroids, improving absorption of pulmonary infiltration, and improving quality of life. So while waiting for effective drug treatments to be developed, can readily available herbal medicines and natural products be helpful? Interestingly, an editorial published in Nature Plants, which is a subsection of the respected journal Nature, highlights that as an option. It states that while waiting for clinical trials to prove the efficacy of drugs, readily available herbal medicines and natural products with proven safety can buy time as a first line of defense. Now, just to state the obvious for clarity, the research is not saying that traditional Chinese medicines cures patients of this virus. Okay, so how does this relate to a Lyme patient? Well, let's have a look at which traditional medicines were used in China during the previous coronavirus outbreaks and this outbreak. They include herbs like licorice, Isatis indicotica, Scutellaria, Hotunia, Artemisia annua, quercetin, and many other herbs. Many of these herbs are probably familiar to you, especially if you're on a herbal protocol for Lyme, and you might actually be taking one or more of these herbs. Now, something else that Lyme patients may be more familiar with than other people is the phrase cytokine storm. This is a phrase that has occasionally made it into the press recently as a result of this pandemic and refers to an exaggerated immune response. In simple terms, the immune response to this virus is two-phased. The early stage is where the virus may cause mild symptoms and hopefully it resolves on its own. However, in some cases, this can progress to a severe stage when a strong, exuberant, and damaging inflammatory response occurs, especially in the lungs in the case of COVID-19. Let's look briefly at the immune response when a pathogen enters our body. Once a pathogen, like a virus, enters our body, our innate immune cells, like macrophages, neutrophils, and natural killer cells, can immediately recognize this as a foreign particle and mount a first line of defense. If the innate immune cells are not able to deal with this virus on their own, or they are overwhelmed, then they will call for more help from other immune cells. And they do this by producing these signaling molecules called cytokines and chemokines. Now, in some cases, these signaling pathways can be exuberant and vigorous, and this can lead to a lot of tissue damage. Now, some of you that are on a Lyme protocol might have experienced a cytokine surge in the form of a Herxheimer reaction. Prior to a Herxheimer reaction when dealing with Lyme, strategies to support the immune system may have been in place, such as taking the herbs mentioned earlier, taking vitamin D, vitamin C, and zinc. However, during a cytokine surge, it would be better to avoid stimulating your immune response too much and focus instead on dampening this inflammatory response by using anti-inflammatories such as fish oil, turmeric, and resveratrol. So when it comes to Lyme, one of the primary strategies from a nutritional perspective is supporting immunity. If you have already been doing this, that's great, and that could be beneficial in dealing with any infection, including hopefully COVID-19. In conclusion, in terms of research and understanding this pandemic, we are really at the beginning of a long journey. But I hope some of this information has been useful and possibly even offered a hint of reassurance during this pandemic time. Thank you, and I hope you stay safe and well.